So in terms of the housekeeping, please note that this session is scheduled for 3 hours. That is from 10 o'clock until 1. Please stay until the end to get your information firsthand and to ask questions. We do have a Q&A function on Teams, YouTube, and Facebook. But if you want to ask a question, then we'll wait until the end of the session. Towards the end of the workshop, you will be requested to complete a survey to confirm your attendance and also to rate the workshop. The presentation will be made available on the Pharmacy Council website, as always. So just a background, this workshop serves as a preparatory session for the upcoming Eisa. Focus of the exam of this workshop will be on the content of the exam itself and will include examples to assist in your preparation. There will be coverage of which references to use to prepare as well as for use during the exam. And we'll also cover on how to book the exam and also getting your device or equipment ready for the examination. You'll see there's different venues for the exam, including the SAPC offices if you don't have anywhere to write or if you do not have the equipment. In terms of the program for the day, the welcome is by myself. My name is Puseleza Mokgano. I'm the manager responsible for the Eisa. And we have Dr. Fogati, who will cover the format and content of this of the examination and assessment, as well as Ms. Berry, who will assist with the calculation and also the going through the examples. We will have a break. We'll have the break, which will be for 10 minutes. And after that, then we'll go through the preparation of the general section as well as the examples. And then we'll get to our Q&A for the calculation and general section. And after that, then we'll go on how we prepare for the remote examination and then have Q&A, and that will be the end of the session. So for now, I'll hand over to Dr. Fogati, who will take us through the format and content of the examination or the assessment. Thank you.
Good morning, everyone. I hope that you can hear me, and I have also put my camera on so that you can see who is speaking to you. Thank you, Puseletso, for the introduction, and I'm going to start with the format of the Eisa examination. As Puseletso introduced me, I'm Dr. Fogarty. I'm from Nelson Mandela University, and I'm a moderator for this assessment. Those of you that don't know what Eisa stands for, this word here that we all use so freely is the External Integrated Summative Assessment Examination for Pharmacist Assistant Basic. And so I'm going to talk you through initially just what the format of the exam is so that you know what to expect. And then I'm going to hand over to Mrs. Berry, who will take you through the calculation section, and then I will see you again when I get to the general section. So as far as the exam is concerned, it is an open book online examination, and it will consist of 100 multiple choice questions. You are required to achieve a 50% to pass the exam, but importantly, we do not make use of negative marking in this exam. And you will also have 3.5 hours to complete the examination. The breakdown of the exam, there are 16% or 16 multiple choice questions, and you have to achieve 50% for the calculation section independently of the general section. So if it's 16 multiple choice questions, the sub-minimum being 50%, you have to pass or get 8 questions correct in the calculations to pass. And then similarly, there's a sub-minimum for the general section. There are 84 multiple choice questions, and you need to achieve 50% for that section as well. Right, so if we look at the different sectors that people are writing from, remember that we are testing a generalist, yeah? So we are testing community, institutional, manufacturing, as well as wholesale. So the questions are then related to exit level outcomes based on tasks that we expect candidates to be able to perform in any of the 4 sectors mentioned. So although you may have trained in community pharmacy, you need to be able to answer questions in any of the other sectors as well. So what do we mean by exit level outcomes? If you look at the exam content, the exit level outcomes are divided into 4 exit levels. If we look at exit level outcome 1, it's to apply basic knowledge to provide technical support in delivering pharmaceutical services. The second exit level outcome 2, is to provide technical support for receiving, storing, picking, packing, and distributing of orders, and to perform stock counts and participate in stock taking in compliance with good manufacturing practice, good wholesale and distribution practice, as well as good pharmacy practice. And so ELO2, if we're to sum it up, you could look at it as if it were all about stock and stock taking. Right, so then we've got ELO3, which is your third exit level outcome. And this is to provide technical support for the manufacture, packaging, and repackaging of non-sterile medicines and scheduled substances in compliance with good manufacturing practice guidelines under the supervision of a pharmacist. So again, for this, if you had to sum it up, you could say that this ELO is about the manufacturing of medicines. And then finally, the fourth exit level outcome is to provide technical support for the compounding, manipulation, and preparation of non-sterile medicines and scheduled substances in compliance with standards described in your good pharmacy practice rules and your good manufacturing practice guidelines under the supervision of a pharmacist. Now, if you know your scope of practice well, you will see that these ELOs tie in very carefully and appropriately to your scope of practice. So ELO4 then is about doing extemporaneous compounding in a pharmacy, so small scale compounding in a pharmacy. Right, so if we look at the breakdown of those ELOs within the exam, 40% of the questions will come from ELO1. That was your basic scientific principles. Then ELO2, which was your stock management, there's 25% of the exam questions will come from that section. And then ELO3, which was manufacturing, there 15% of the questions. And then 20% of the questions will come from the compounding ELO. Now we're going to look at each of those exit level outcomes broken down into a little bit more detail so you know what is expected from each exit level outcome. So for the first exit level outcome, which is the bulk of your examination, you need to be able to apply legislation related to your scope of practice as a basic pharmacist assistant. So anything to do with the Pharmacy Act, the Medicines Act, and related legislation, you need to be able to apply that in terms of your scope of practice. It's important to also demonstrate ethical and professional conduct related to your relevant scope of practice. So knowing what Board Notice 108 of 2008 contains in terms of your code of conduct, as well as the ethical rules, is important for you to understand what those are and be able to apply those in different scenarios within the context of different sectors of pharmacy. Then thirdly, you also need to be able to apply basic pharmaceutical terms and concepts concerning non-sterile drug delivery systems and their routes of administration. So understanding what different dosage forms are, how those different dosage forms are administered. So I would say basic pharmaceutics needs to be understood for you to be able to tackle exit level outcome 1. And then finally, for exit level outcome 1, you need to be able to apply basic scientific principles and perform basic scientific calculations. And Mrs. Barry will take you through some examples of that in case you're not exactly sure of the level of calculation you are expected to do. That takes us then onto exit level outcome 2. And we said that exit level outcome 2, the focus is stock management and stock control. So you need to be able to answer questions related to distribution and control of stock of medicines, according to standard operating procedures and according to good manufacturing practice, good pharmacy practice, and good wholesale and distribution practice. You also need to be able to answer questions about picking, packing, and securing orders for medicines or scheduled substances, and what documentation is related to the distribution and control of stock, as well as picking, packing, and securing of orders, relevant again to your scope of practice as a basic pharmacist assistant. And then finally, you need to be able to answer questions about stock counts and stock take. Then ELO3, that brings us to manufacturing. You need to be able to apply pharmaceutical and good manufacturing principles, as well as the legislative requirements in manufacturing, packaging, and repackaging of non-sterile medicines. You need to be able to organize and prepare resources, materials, and equipment for the preparation of specific medicines, following relevant standard operating procedures and process documentation. You need to be able to handle materials, considering environmental and storage conditions, as well as transport and security requirements, participate in manufacturing processes for non-sterile medicines and scheduled substances, be able to answer questions about packing and repacking of medicines on a large scale in a manufacturing facility. And you need to be able to answer questions about the documentation required and records that need to be maintained in a manufacturing environment. And then finally, in ELO4, we cover questions around compounding of medicines. So applying principles of GPP concerning the compounding of non-sterile medicines. You also need to be able to follow a formula of compounding for a simple solution, a suspension, and a semi-solid. You need to be able to complete any records associated with extemporaneous compounding, know what to do when checking and cleaning equipment, and be able to perform housekeeping activities according to SOPs. And then finally, you need to be able to operate a personal computer to be able to generate documents and spreadsheets. So just the basics of knowing how to operate a computer, as well as a word processing document, and then an Excel, for an example, an Excel spreadsheet. And then what we do in terms of the types of questions we ask. So each out of the 100 questions, there's 16 calculation questions, and there are 84 general questions. Those are divided then according to the different exit level outcomes. But then within each of the exit level outcomes, we also ask different types of questions. So some questions might just be basic knowledge and comprehension questions. So how we would describe that is that would be a question that is directly from your notes. For example, a definition. We might ask you, which of the following statements best defines, and then we'll give you a concept. Best defines a tablet. And then there will be 4 statements, and that we would consider to be a knowledge question because it is a straightforward definition, or it's something you would be able to access out of your notes. Then the second type of question is referred to as an application question. And an application question just requires a little bit more thinking. The question is more applied, so there might be just a very simple scenario, and then you will have to apply your knowledge to be able to answer the question. And then the final type of question is analysis, synthesis, and evaluation. We also refer to these questions as problem-solving questions. So in this case, you might get a scenario, but you need to think of maybe more than one consideration within the question to be able to get to the right answer. And so there are going to be some examples, both that Mrs. Berry and I will cover with you today. But when you write the practice exam, which is a full 100 question exam, you will see other examples. Now, for the basic paper, the bulk of questions does sit in knowledge and comprehension and application, but there are a few questions that are set at the problem-solving level. And so you might say, oh, this is a more difficult question. And that's because it requires you to think a little bit more than just what you would for a knowledge question. So what do we recommend in terms of preparing yourself for the exam? Well, there's some administration that you need to do yourself. You need to know when the exam is going to be written and at what time. You need to decide where you're going to write the exam. Remember that this is an online exam. You can choose to write this exam in your own venue or at Pharmacy Council. And the office will explain a little bit more to you later as to what is involved in that. And then you also need to determine what resources you will need for that to be able to write that exam. You need to prepare the exam. That's what you're doing. This is the start of preparing for the exam, because you need to know what references you need to go through and understand to be able to cover all those exit level outcomes that we've spoken about. But also what references you are allowed to use during your online exam. We said it's an online open book exam. And so you are allowed to use resources, but there are limited resources. And again, the office will explain to you which of those resources are available on the exam platform for you to be able to access. It's no use starting the exam or going into the exam without ever having looked at a reference, because if you haven't looked at that reference source, you don't know where to find the information in that reference source to assist you in answering the questions. You also, for an open book exam, an open book exam doesn't mean I don't learn. An open book exam means that I learn, and while I'm in the exam, if there's something I'm unsure about, I can access the resource to confirm my understanding, and then you apply what you know to the question, particularly for the application and the problem-solving questions. Right, and then finally, for the actual exam, what do you need to have available? Well, you need to have a secure Wi-Fi connection, because it's an online exam. And an electrical, in South Africa, we have load shedding and we have power outages all the time. And so you need to know that you've got backup power available to you at the venue that you're writing, or that your laptop or whatever device you're using is fully charged, so that the electricity won't affect you writing your exam. It's very important that you stay on this call for the full 3 hours, because the office will go through how the online exam works, how you register for the online exam, and how you prepare yourself for the online exam in terms of the technology that is used in invigilating the exam. And then, as we've spoken about, the exam is 3.5 hours long. And so you need to know that you've got that 3.5 hours to write the exam. So you may need to take leave from work, or if you are writing at your workplace, that nobody interrupts you for those 3.5 hours that you are preparing, or that you're busy writing. Okay, so some other tips for preparation. Make sure that you're using the latest reference material. Remember that especially the legislation gets updated all of the time. There's new board notices printed and published all of the time. Every Friday, the Government Gazette is published with new legislation. In terms of scope of practice, new legislation was published just last year in 2024. So if you're using the old 2000 regulations, make sure that you've also got the current 2024 regulations with you, because that is what you're getting assessed on. You're getting assessed on the latest information, not on what you may have learned when you were a basic assistant registered with your provider. We're testing you on the latest information. Make sure you are familiar with what is happening in current events, and we're referring obviously to health-related current events. Is there a pandemic that has happened recently? Is there an outbreak of measles, etc.? Because we may question you on things that are relevant and happening currently in the news. Make sure that your course notes are relevant. Again, many of you may have studied a little while ago, and so your course notes might be a little bit outdated. So you need to check if the information is still valid. Familiarize yourself with your reference material, and make sure that you've covered sufficient information that you can answer questions on each of those exit level outcomes. Never use a reference that you have never used before. And the reason for that is because it's going to create panic. You can't find information, or suddenly there's all of this new information that you've never seen before because it's a new reference source. So only access references that you know, that you can work your way through, that you can navigate through. Don't try and use a new reference that you've never used before. Also, use your work environment to study. Look at your standard operating procedures in your workplace, because a lot of the SOPs are written from good pharmacy practice guidelines, or good manufacturing guidelines, or good wholesale and distribution practice guidelines, depending on the sector that you're working in. But again, remember that this exam is covering all sectors. So don't just focus on community or just focus on manufacturing. You need to make sure that you have got an overview as a generalist across all 4 sectors. And then use your colleagues and your supervisors as get assistance from them, those with more experience. But again, keep in mind that you need to be using the latest information, the most updated information when you write your assessments. And so with that, I'm going to now hand over to Mrs. Barry to cover the calculation questions.
Thank you very much, Dr. Fogarty. Let me just share my screen. Okay, good morning, everybody, and welcome to the workshop. I hope you've learned something already, and let's get on with the calculations. I am, as Dr. Fogarty said earlier, she's from NMU, and so am I, Nelson Mandela University, and I've been an examiner or setting questions for the Eisa exam since 2021. So it's my 4th year doing this. And today I'm going to go through a couple of things just to help you a little bit with your preparation for calculations. At the end of my section, we are going to, you've got a link. I'm going to give you a link, and you're going to do 10 examples, and then we're going to work through all of those examples. Okay, so without further ado, let's get started. Our first slide basically tells you, as you've learned already, about the ELOs. So you've got ELO1, ELO2, and ELO4, where you've got calculations sitting. ELO1 is your basic scientific pharmacy-based basic scientific calculations, and that's 50% of the calculation questions will come from that section, from that ELO. So that is 8 questions coming from ELO1. Your stock take and stock management is your orange part of the pie chart there, and that's 19% of the questions will come from that. And the last ELO, the compounding questions, will amount to about 31% of your 16 calculation questions. So again, just to say, the ELO1 is your basic scientific principles. Here we will do some basic conversions. We'll do some examples as well, but your basic conversions like milligrams to grams, micrograms to milligrams, that type of thing. ELO2 is your stock management. Here the questions will be in connection with stock consumption, reconciliation calculations in stock management, and cost or value of stock. For instance, with your stock management, we might give you a table with different stock items on the left-hand column, and then each column will have a different a description of that particular line item. It might be the batch number, the expiry date, and it might also be the strength of that particular item. We would then possibly give you a pre-stock count amount and a post-stock count tally of that particular item. And then the question might be something like, what is the surplus amount of the particular item post-stock take? So how much extra stock do we have? And we give you 4 possible answers, and you've got to then calculate and look for the right stock item. So that's just one example. I've given you a bit of an example here because in our 10 questions, we don't have one of these. But in your practice Eisa exam, you will see some of these examples. Our ELO4 is our compounding manipulation and preparation, or extemporaneous compounding calculation questions. Here, you might have to calculate quantities of ingredients according to a formula to prepare an extemporaneous formulation, and then maybe also reconciliation calculations and repackaging operations. I will give you a couple of examples in your at the end. Recommended textbooks for calculations. We've got the pharmaceutical calculations by Ansel, and then also another one, pharmaceutical practice calculations by Winfield. Excuse my pronunciation. The last one is pharmaceutical practice, Winfield and Reese and Smith. Just to make sure that you understand that textbooks are really more for practicing for the exam. You're not going to dive into a textbook to look for an answer.
It doesn't look bad.
Multiple choice 100-mark Eisa exam. Number one, you're not going to have a time, and number two, you're not going to find the exact question in the textbook. So the textbooks are there for you to practice and to help you to prepare for the exam. Not all calculation types in the textbooks may be applicable to the exam you'll be writing. So please just remember that these pharmaceutical calculation textbooks apply to the whole range. So it might even be that you're looking at a calculation that is really on a very high level, and it might be more to the scope of practice of a pharmacist, and not necessarily a basic basic for you guys. So calculation tips and advice. The first one is most importantly, and it kind of comes from that looking at the textbooks, it's very important to understand the principle and not to memorize the calculations. We do not use calculations that you're going to find exactly the same one in a textbook somewhere. So it's very important to understand the principle. That's why we really only have 10 examples that we're going to go through with you, because each one, there might be 100 different iterations of that particular calculation. But at least when we're going through the examples, it's the way that we ask the questions that will be quite similar. So if you are worried about how we're going to ask the questions, this is your opportunity to go through the examples and see how we ask. So it's important that you know the SI units, and obviously the SI units are the International System of Units that you've learned already from school days. You have to know what does percentage mean, weight per volume, what does that mean? And you've probably done that in your notes as well in your course. It's important to have a scientific calculator with you during the examination, and also to use the same one that you practice on to use in the exam. Check the batteries, know the settings of your calculator. Don't borrow a calculator at the last minute and now you don't know where the equal sign is. Have enough paper and pens next to you. Even though it's an online exam, you do need to scribble down and try to do the calculation on paper next to you, as you obviously are aware. Some other calculation tips are to select the correct formula. So remember, when you are possibly doing some of the stock management calculations, it's important to use the correct formula. And for that, you can use your reference sources, or if you know them off by heart and you've studied them, that's great. Transcribing, very, very, very important, is to double check against the question that you've used the correct figures in your formula. So if you are applying a formula in your stock management or wherever you're applying your formula, make sure that you don't transcribe the numbers from the question differently onto the piece of paper that you're writing down to do your calculation. If possible, estimate a range for your answer. Now, this one is so very important, and we see it at the university. We see it as a teacher, is to actually look at your answer and see if it makes sense. For instance, let's use an example. If I have, okay, you guys are all in practice and you're working, maybe let's say we're going to give the patient 5 mils. You know, a medicine measure is 5 mils. So we're going to give the prescription is 5 mils 3 times a day. And maybe let's say it's for 5 days. This is just a very simple example. 5 milliliters 3 times a day for 5 days. Now we've got to calculate how many mils do we actually need to dispense for this particular case. If I now come up with, I must dispense 1,000 milliliters for this patient, and I think, how much is 1,000 milliliters? It's 1 liter. Imagine giving any patient 1 liter of medicine. There must be something wrong with my calculation. But if you get up to 100 mils, maybe that's more. Maybe I've added a 0 somewhere or multiplied by an extra 0 somewhere. So try to look at your answer and logically think, does that make sense? Is it really 1,000 mils? Can we really give a patient so much? So estimating is something that you've actually done at school as well, to look at the question and decide, does the answer actually make sense? So estimate a range. Always double check your calculation. So I always do it 3 times on my calculator to make sure I'm right. If the first time is different to the second time, you know you have to do it a 3rd time. You do have time. We're going to come to the time just now, but it's important to go back and double check your answers. Some tips when we're doing conversions. If you look at the rectangles in the middle, these are our SI units. So we've got micrograms, milligrams, grams, and kilograms. Okay, micrograms is the smallest, tiniest amount that we can get on this. Obviously, we get smaller, but on this particular scale, it's the smallest. And kilograms is the biggest. So if we've got 1 kilogram, if we go down to grams, we're going to have a lot more grams than we will have kilograms. So this is what we're looking at with this bouncing up and down. If we go from micrograms to milligrams, the number of units should get smaller. So we divide it by 1,000. If we go from milligrams to grams, again, the number of milligrams versus the number of grams becomes smaller. Even though a milligram is smaller than a gram, there's a whole bunch of milligrams that can fit into 1 gram. So think of it that way. So the number gets smaller as we go towards the right. That's why we divide it by 100. If we go from kilograms to grams, the actual number that we're going to be getting should be bigger, because 1 kilogram, you can fit a whole lot of grams into 1 kilogram. So the number is going to get bigger if we go towards the left, which means we will multiply it. Okay, we'll do some examples of conversions, but you can find 1,000,000 examples. You don't even need our examples to show you exactly. You just do your basic conversion examples. And I think, yeah, you can find enough examples online or in the textbooks if you have a look at the textbooks. Also, the same goes for liters up to kiloliters, microliters, milliliters, liters, and kiloliters. If it's going to a bigger volume, kiloliters is the biggest volume, and microliters is the tiniest little amount. If we're going towards the right-hand side, we would be dividing, because our final answer is going to get smaller. If we're going more towards the left or towards the smaller units, the smaller microliters, we would be multiplying. Okay, so practice converting between these, and the reason you would understand why we've got 2 slides on this is because it is very common that people, when you're busy doing your conversions, you multiply instead of divide, or you divide instead of multiplying when you're doing a conversion. So make sure you understand converting. I referred to time just now as well. It's very important. We look at 3.5 hours and we think, wow, that's a lot of time. But anyone that has written a open book test will tell you that 3.5 hours is not long enough. Dr. Fogarty's already referred to, if you haven't looked at a reference yet, don't bring a reference into your first open book and now start looking at it for the first time. So you really need to know where to look in those reference books, and paging through reference books to try and find something is going to take a lot of time. So for your multiple choice, if you look at your time, your 100 questions that you have, you've got 42 minutes to do 16 calculations. If you go and calculate that for the 3.5 hours, it works out to 2.6 minutes, or basically 2.5 minutes per question. So when you're doing the practice Eisa, it's important to look how long you're taking with your calculation questions. Some of them might be really simple and you can answer them in 5 seconds, but some of them might take a little bit longer. And you'll see when we do our little practice at the end of this how long it takes you. Actually time yourself. We're doing 10 questions. It should take you about 2.5 minutes. So then it should take you about 25 minutes at the most. Wait, 2.5, I'm only going to give you 10 minutes. Okay, so we're going to see about that. So you've only got 10 minutes. If you finish this, then you'll be fine for the exam. Also, as Dr. Fogarty mentioned, we don't do negative marking. So it's important not to leave anything blank. If you really, really, really are stuck and do not understand, try to do an estimate of what you think it could be. Okay, but most of the time with the calculations, you should be able to get to the exact answer on your page. So now the next step is to let's go and do 10 examples. We've got 10 questions. It's on a Google form. In front of you on the screen, we have our QR code. So you can either scan the QR code. It'll take you to the short little Google form 10 questions that we have. And I'd like you to actually do the little 10 question test that we have. It's not a test, just an example test. You can also plug in the this link into, if you can't use the QR code, you can plug in the link into your computer. And I'm going to now give you about 10 minutes and then we're going to start again. I'll just watch how many people have finished. So it is now 10:38. We should be able to start again at 10:48. Okay, good luck, and I will leave this on for you. Okay, at the moment I have, let's just quickly see, 75 responses, and there's 200 people, 216 in the session. So I'm going to wait another 2 minutes, and I'll start just, at 10:52. Okay, so I think I'm going to, I know not everybody has completed, and you can carry on while we're talking. Or perhaps you can go back after we finished, and you can go and go back to your answers that you haven't completed yet. So just to, let me just quickly make sure that my screen is showing. Double checking that you can all see my screen. Okay, great. Okay, so the first question was one of the conversions that we said that you would be getting. And the question basically said convert 5 grams into milligrams. Most of you got this one right. 68% said 5,000. So we took 5 grams and we multiplied it by 1,000 to get to milligrams. If you go back and have a look at the, okay, I'm not going to go back there now, but if you go back and have a look at the 2 slides that I showed you, if you're moving from grams to milligrams, the final number should be bigger. So remember, you've got to multiply. You cannot be dividing. So go back and have a look at those slides. If you were part of the 9% or 18% that did it the wrong way around, just go back and have a look. Always look at that and think to yourself, which one is the smaller unit? Is it milligrams or grams? And then you know milligrams is tinier. So the number 5, the final answer has got to be more than 5. So it's got to be bigger because it's going to a more tiny, you're breaking it up into more parts, if I can call it that. Okay, so that is the first question that we did. And the conversions will be quite similar to this. So that's the first one. Second question was also, there's obviously 70% of you, it's consistent. So 69% of the respondents got it right. How many medicine measures are there in 30 milliliters of cough syrup? So this one was, if you have a look at that, and now you should know that one medicine measure equals 5 milliliters. So if you say 30 divided by 5, you should get to the final number, the correct answer, which is 6. So 6 medicine measures, if we go the other way around and we just want to check, we say 6 times 5, that gives us 30. So most of you answered this one correctly. The next question said, what does 25% mass per volume mean? Now, mass per volume is something that you should have, it is in your module, so you should be studying this. But when we talk about mass, we're talking about the weight of something. Volume is the amount of liquid. So standard, when we say mass per volume, the mass is always in grams, and the volume is always in 100 milliliters per. If it says per something, it's per 100 of that, and it will be volume in this case, which is milliliters. So if we say mass per volume, we're looking for grams per milliliters. In other words, here, if we look down at the bottom here, we're saying 25% when we're looking at a percent and we've got mass per volume, it should be 25 grams per 100 milliliters. So there we have 25 grams per 100 milliliters, and that's because we are looking at a percentage. So as soon as we're looking at the percentage, we know that this should be 100. The number at the bottom should be 100. And we know it must be in milliliters. So mass per volume is grams per milliliters. If it was mass per mass, it would be grams per 100 grams. If it was volume per mass, it would be milliliters per 100 grams, which doesn't really make sense. But anyway, you get my, I hope you follow my drift there. So 25 grams per 100 milliliters. It can't be 250 because we're looking at 25%. And we must look at the standard, which is wherever it says mass here, you're going to be working in grams. And the bottom one will be in milliliters, but it's always per 100. Okay, so that is the first one. The third question that we've done. The next question, I think solely, you guys did so well on this one. Well done. Congratulations, you can give yourselves a big hand. What is 50% of 16? So I think that's one that we all work out. When you were at school, even everybody wants to know, what did I get for the test? So everybody knows how to work out percentages. We usually have a very nice response with anything like this. So excellent. It was 50% of 16 is basically 50 over 100 times 16, or half of 16. So you've already worked that out. How many of the calculation questions do you need to get correct in your Eisa exam? 50% you need correct, which means that you need to get 8. So there's your answer. I think Dr. Fogarty gave it away earlier. Okay, the next one is, and I need to go to the other screen because we don't see this so well. So I'm just going to cut across. Let me just go back. Preview questions. Okay, I'm just going to quickly, I don't see the rest of this. Okay, where were we? There we go. A person weighed 70 kilograms at his previous doctor's visit. At his current visit, the patient lost 5% of his weight. How many kilograms has the patient lost? So what is the calculation we need to do there? The calculation is we need to work out 5% of the 70 kilograms. How many kilograms has the patient lost? So 5% of 70 kilograms. Let's go back and I'm going to show you the response. 5% of 70 kilograms, and you should have got to 3.5. That is the correct answer. 3.5 kilograms. So 5%, you've got your calculator next to you. Everybody knows how to calculate that. Or if you don't know, you can say 0.05 or 5 divided by 100 times by 70. Okay, and then you will get your answer. So congratulations, 83% got that correct. The next question is one that is often not answered correctly. So don't feel too bad if you didn't get this right, but we're going to get it right today. Okay, if 20 milliliters of alcohol are added to 40 milliliters of water, what is the ratio of alcohol to the total solution? So I'm just going to drag my other screen in here. Okay, so if I'm going to write on the screen, I hope you can all see that. If 20 mils of water, so I always like to draw, my drawings are very, very bad, so please excuse this. If this is 20 mils, okay, of, I think it was water. If we add the 20 mils, I just want to see if you are seeing it. Okay, so if we add this 20 mils, okay, now we've got another beaker over here. Well, my drawing is really, really bad today. I do apologize. And this is 40 mils of water. Okay, if we add the 20, we pour it in to the 40. What do we have in this beaker over here? In the total, remember the question spoke about the total. So what do we have here? We've got 20 plus 40. You guys are all going to get that if that was the question. We've got 60 mils, correct. So we've got 20 mils. We added to 40 mils of water, and we left with 60 mils. Now, what is the rate? Well, the question said, what is the ratio? If 20 mils of alcohol are added to 40 mils of water, what is the ratio of alcohol to the total solution? To the total solution. Okay, what is the ratio of the water, the 20 mils of water, to the total solution? This is the total solution, 60 mils. So therefore, when we're doing our ratio, we must say 20. Okay, and we're doing a ratio. 20 is to 60, not 20 is to 40. Okay, it's not the ratio of the two things that we're adding together. It's the ratio of the 20 mils to the total at the end. And then I think you would probably be able to do this because basically you can divide one side by 20, you divide the other side by 20, and your final answer will be 1 in 3. I hope you all understand that, but what I would suggest is to get yourselves some more examples of ratios. It's very important to understand. You can see that most of you, well, not most of you, but more than half of the respondents got the incorrect answer here. So please do more ratio examples, and especially you will get them in the practice exam as well. So make sure that you understand ratios. The next question is during the packaging. Okay, now apologies. I need to go back to our questions again. Where are we? During the packaging of a batch of medicine. Okay, while we're busy packaging medicine, 1,980 labels are used from 2,000 that were issued. So there were 2,000 labels issued and only 1,980 were used. What is the percentage of labels that must be returned to the dispensary? The first thing that's very important, and you can, when you are reading something like this, even write down the important words. Read the question again. What percentage of labels must be returned to the dispensary? What percentage? We're looking for the percentage, and what are we looking for? The labels that are returned. In other words, the labels that are not used. So how many labels are not used? They said 1,980 are used, and there were 2,000. So how many are not used? There should be, you say 2,000, you put it in your calculator, 2,000 minus 1,980. So we left with 20. So there are 20 labels that are not used. And what percentage of labels must be returned? Okay, if I'm going to go to my little screen again. So if we have 2,000 labels, okay, we have used 1,980. we've got 20 left. So what percentage of labels must be returned? We say 20 over, and the percentage of the total. So it must be 20 over 2,000 times by 100. They want it as a percentage, and we then get our answer. So 20 divided by 2,000 equals times by 100, and that will give you 1. Oh, whoopsie. Okay, that should give you 1. Let's go back to my present mode. Okay, I'll get there now. So the correct answer is 1. So those of you that said 20, you didn't read the question properly. What percentage of labels should be returned? Please make sure you read your questions. This is common mistakes that we find, that the people know exactly, that a person knows exactly what the answer is, but they haven't read the question properly. So that is a lesson. Okay, another question here, and this is, okay, we've got 2 possible answers here, 40 or a 42. So let's quickly have a look at the full question. 50 containers of a medicine, so we've got 50 containers, are counted during a cycle count. Of the 50 containers, 5 are expired, 2 are short dated, and 3 are damaged. Okay, using the information given, how many containers of medicine can still be issued? Okay, let's have a look at that again. 5 are expired, 2 are short dated, and 3 are damaged. So using the information given, how many containers can still be issued? So let's work it out. Of the 50, think about it again. Maybe those of you that didn't answer it can think again. I'm just going to give you another moment to look on at that one. There's a little trick to this one. 5 items are expired. Okay, 5 are expired. Can you hand out expired medicine? Absolutely not. No, not at all. Remember, we're giving this out. We're issuing it. They're going to use it. 2 are short dated. Can we use a short dated item? Absolutely. We can't, if we get it into stock and it's short dated, we'll return it. But once it's on our shelf, as long as it's not expired, we can issue it. So the 2 short dated, I think this is where the trick came in. 2 are short dated. Those we can still issue. And 3 are damaged. Can we issue 3 items that are damaged? Absolutely not. So the 5 that are expired and 3 that are damaged cannot be used. 5 and 3, that's 8. Okay, so we've got 8 that we can't use, but the other 2 that are short dated, as long as the patient gets it before it expires, we're good. As long as the patient can finish using it before it expires. So the 2 short dated we can still use. So there are 42 is your correct answer. So this is a good example of problem solving, because if we just look at it at face value, and if it was a level 1, Dr. Fogarty spoke about the knowledge and the applied questions, and then the more problem-solving questions. This is an example of a question where you've got to actually problem solve. If it was a more basic calculation question, we would not have included the 2 are short dated. We would have just said 5 are expired, 3 are damaged. How many can we dispense? Okay, then you would have known it's 42. But we've thrown in there that 2 are short dated, and you need to problem solve to be able to understand that we can still issue those 2. Okay, so that is a very good example of a problem-solving calculation question. Although technically all the calculation questions are problem-solving, but it's a higher level. Okay, our second last question. What is the total value of 15 containers of a medicine that has a cost per unit of 130? Okay, the total value. Again, if you said 8 Rand 66, you were dividing here Okay. And I think perhaps you didn't understand the cost per unit. So the total value of 15 containers of a medicine that has a cost per unit of 130. Each item is 130 Rand. Okay. You've got 15 of these. Each container is known as a unit. Okay, I think that was where the confusion came in. So the 15 containers means it's the same as saying 15 units. So basically this one is 130 times 15, and then you would get to the 1950. Okay, for those of you that divided it, perhaps you thought that there were 15 containers in a box and one box was 130 Rand. So maybe there was a little bit of an understanding there. In this question, the meaning was that 15 containers, meaning 15 items, 15 units, it's all the same thing. Okay, so we get to 1950. The last question, also maybe a little bit of that weight per volume, a little bit more of an applied question here, problem-solving question. What percentage in weight per volume? So you need to answer it in weight per volume. Solution will be obtained when 5 grams of chlorine is added to 500 milliliters of water. Okay, so let's go to, oh gosh, now I just need to find my, oh, there's my writing screen. Okay, so let's say we've got 5 grams of chlorine. 5 grams of chlorine is added to 500 milliliters of water. Okay, here we've got water, and there we've got our chlorine. Okay, as I said, I can't draw very well. Okay. They want to know what is the percentage mass per volume. This is our answer. So what do we want? We want it in a percentage, and we want, what do we know about mass per volume? We want it in grams, the answer. And we want the volume must be in per 100 milliliters. Remember, this is standard. If they give you this, you should know that. If they want it as a percentage in mass per volume, okay, I just want to go back to, oh gosh, apologies. Now I've jumped completely out of that. Okay, let's have another look. What percentage weight per volume, or mass per volume, weight per volume, is the same thing. Solution will be obtained from 5 grams added to 500 ml. Okay, let's have another look here. So now when we are doing our calculation, we are going to say we've got, and you might have been taught this a slightly different way. I might teach it a different way. I do cross multiplication. So we've got 5 grams in 500 mils. We want to know X grams in 100 mils, because that will give us our per 100. Okay, we do our cross multiplication. We get X on the left-hand side, we're going to get X times 500 equals, and on the right-hand side, we're going to get 5 times 100. Okay, I just want to lower this slightly so I can keep drawing. And if we want our X on its own, we divide the left by 500, the right by 500, and we get X equals 1. And our answer is weight per volume. So it's 1 grams per 100 mil, or 1% mass, weight per volume. Okay, let's see the answer and how we all did. Go back to this one. There we go. So the correct answer was 146%. And that was your last question. So this is also one that is, you guys have to practice these. These are quite, there's a lot of examples that you can practice with these. Just be aware of the level that you're doing it at. And there are some questions that are even more complicated and even more applied, but this is the kind of way, that's the whole reason, the kind of way that we're going to ask you. In your practice Eisa, you'll also get quite a few examples like this. So that is the end of my calculation section. Dr. Fogarty, can I hand over to you? I think that was my last slide.
I just want to stay on the slide. Sorry, if
Oh,
you can just
sorry,
stay
yes.
on the, just
Sure.
another tip to give you all. You need to read the questions very carefully, because if we had used a different unit, so we had said 5 milligrams of chlorine is added to 500 mils of water, there's an extra step that you would have to perform to get from milligrams to grams. The question is asking for percentage weight per volume, so you know that your answer needs to be in grams, and you cannot work with different units. So we know that the answer needs to be in grams, and in this particular case, you are asked for grams, so there's no extra step. But if you were given milligrams or even kilograms in this step, then you would need to perform a step to first get to grams before you continued answering your question. So I just wanted to point that out as well. Make sure that when you are reading your question, check what the unit is and then what is required in terms of the answer. Because if they give you grams in the question, but then they want milligrams in the answer, there's always an extra step. So make sure that your units match one another.
Yeah, if I can just add, so this step, you would have one just before it, where if they've given it to you in milligrams, you would first have to convert it. So there would be another step before you do this step. Great, thanks for adding that, Dr. Fogarty. And then can I stop sharing? Oh, okay, great, thanks.
Yes, you can stop sharing. We are going to take a short break now. If Pusaletso can just remind us how long the break is going to be.
Apologies, the break will be 10 minutes. Thank you, Dr. Fogarty.
Right, everyone. So we will see you in 10 minutes. And that will take us to around 11:25. Right. Still good morning again. So hopefully you've managed to get a cup of coffee and you're back on your device and you're able to hear me clearly. I will just make sure, get an indication from the office that I can be heard. Right. Okay. Thank you so much. Okay, so let's move on now to the general questions. So the general question blueprint is divided across all 4 of your ELOs. Again, the bulk of your questions comes from ELO1, which is your basic scientific knowledge and principles, including legislation and scope of practice. So if that's a clue for you, make sure that you know your scope of practice as a basic pharmacist assistant. Okay, it's important. This exam is the basic Eisa, which means that the focus is on the scope of practice of a basic pharmacist assistant. Don't go and answer questions according to the bad habits that you have picked up in practice. This is specific to the legislation and what the legislation says. Then 26% of your questions will come from stock management, 18% from manufacturing, and 14% from compounding. Right, so your reference materials, you are permitted to use books. That means a physical book with you, or if you've printed or downloaded copies of your notes or online references. And again, the office will explain to you how to access some of those online references that are available on the exam platform. There are some images here on the slide. You can see the Martindale, the South African Medicines Formulary, the MIMS, your essential medicines list and standard treatment guidelines can also be used. Make sure you're also using South African relevant reference sources. Okay, many textbooks that you might be able to download might be American and not applicable in South Africa. So make sure that it is the South African setting that you are looking at. So the online reference sources that are provided on the exam platform include the standard treatment guideline and essential medicines list, the primary care, the pediatric and the hospital level SDGs. The Good Pharmacy Practice Manual and associated rules is included, the South African Guide to Good Manufacturing Practice, the Pharmacy Act, as well as the Medicines and Related Substances Act. Perhaps the office can confirm later if this, when you say the Pharmacy Act, does that include all of the regulations, including the practice regulations, which have got the scope of practice, and the regulations of the general regulations of the Medicines Act. But I'm pretty sure that if the Pharmacy Act is there, then they will also have the regulations linked. However, if you can't find them on the exam platform beforehand, please go onto Pharmacy Council's website, because Pharmacy Council's website has got all the pharmacy-related legislation that you could ask for, including the latest updated published legislation for implementation, and it even has pending legislation. Obviously, we're not going to test you on pending legislation or legislation that hasn't yet been published, but all legislation published for implementation is on the Pharmacy Council website. So if you go onto the website, you don't even have to log in. You can see these 5 icons at the top of the web page. Click on the center one, the little book. It will then open this page of publications, and you are most interested in accessing the legislation. If you click on the legislation, it will give you the breakdown of the act, the regulations, the rules, the board notices, and then, as I said, pending legislation, proposed legislation. We won't ask you any questions around proposed legislation, okay? We will only focus on legislation that has been published for implementation. If you click on the Act, for example, it will bring up the Pharmacy Act. If you click on the regulations, you will see that all the regulations will come up. Again, these are regulations linked directly to the Pharmacy Act, not the Medicines Act. The Medicines Act you will have to access through the SAPRA website. Okay, and then obviously rules and board notices as well. And you can download these documents so that you have them on hand. You don't have to go live onto the website every time. Okay, here's an example. If you click on the rules, all the rules that are available. And these are when there are updates, often updates to the GPP, the board notices will be published. Or if there are changes to the fees, that will be published under the rules. And then your additional board notices. Right, so we've already spoken about how to use the reference materials, and we've also said, please don't try and access a reference material for the first time on the day of your exam. You need to prepare yourself, make sure that you've gone through all your reference sources, you know how to work through an index or a table of contents to find the information. Make sure that you know how each of the reference materials that you have brought into the exam, how they work and how you can read them and access them and the related information. Okay. A lot of students, learners make the mistake of bringing in too much reference material. They think the more reference material I have, the better for me, and I'll be able to pass this exam because I'll have all the information available at my fingertips. Unfortunately, that's not true. And it often overwhelms you in the exam because now you've got a question, you're like, oh, which reference source is this in? And you start paging and paging and paging or looking for the information. And unfortunately, you get yourself into an anxious state and then you start performing poorly on the exam. So I would like to say, prepare ahead of time, trust your knowledge and what you know and understand, and answer the question from that first. Don't go and try and check up all your answers in reference books, particularly the applied and the problem-solving questions. You're not going to find those answers in textbooks. So you need to be prepared ahead of time. Have your basic knowledge, your foundational knowledge that you've done in your course material, the things that you've learned in the workplace, the correct things that you've learned in the workplace, not the incorrect things. And then make sure, and then you'll be able to, if you've got those foundations, you will be able to apply the information. You may find that you don't even have to access any of the reference material if you are properly prepared. And then we've already spoken about notes from your provider, whether it's a university or a skills development provider. Those notes might be outdated, so make sure you are using the most updated information. Familiarize yourself with the online references. I've just shown you now where to access the Pharmacy Council website and how to download the relevant Act, regulations and rules. But you also need to have the Medicines Act really readily available, and the general regulations, and then your GWP and your GWDP as well. You can't be downloading the references during the exam. It's part of your preparation. Make sure that you've done that prior to the exam. And then, as we've said, we've shown you the South African Pharmacy Council website, but the SAPRA website has everything that has to do with the control or regulation of medicines. Read the question carefully. We've spoken about this during the calculation section. It's very important. Highlight words, write words down on your scrap piece of paper that are words that you need to be careful of or be wary of when you're answering the question. Because sometimes we try as far as possible not to make questions difficult in terms of language. We're always cognizant of the fact that the person writing the exam might not be English first language. So we're not trying to trick you with the difficult words, etc. So, you know, but when we're looking for a specific answer, there might be a clue in the question in terms of the type of word that is used. Identify the statements which you're sure of. So when you get your STEM, which is your question, you read your STEM and you think, what is the correct answer before you even look at the options? try and identify what you believe the correct answer to be just from reading the STEM. Then look at the answers, the 4 answers that you're given, and identify the one that is closest to the one that you had come up with without having looked at the options. It's often multiple choice questions are difficult because sometimes there's some ambiguity in the options, and that might start confusing you. So read the question, answer the question for yourself, and then look at the options that are available. Okay. You only need to use the reference to confirm something that you are unsure of. And if you're unsure of every single 100 questions, then maybe you're not ready for the exam, and it's not likely that you're going to finish the exam in the 3.5 hours. So the practice exam will be a good indicator for you as to whether you are actually ready to write the final Eisa or not, based on how much time you're spending in your reference sources. So even for the practice exam, you've got to be prepared. Make sure that you've done all the preparation required to be able to go into writing that exam. Okay, remember, we don't use negative marking, and you can come back and answer a question. So if you're unsure of an answer, or you think this is what the answer, this is the closest to the answer that you have, rather mark it than leave it out, because there's no negative marking. Okay, or you can continue and finish the exam and then come back to the questions that you've left out. Okay, so there is that opportunity for you. Then in terms of the way questions are asked, we try not to ask negative questions because they can be confusing and they can be ambiguous. So we avoid as far as possible asking questions that say except, or which of the following is false, or which of the following is not correct or incorrect. And most of what we'll ask is which is true or which statement is correct. Okay. We then also use the words most appropriate or most correct or most best. And we will always put those letters in capital letters, so it stands out for you. And that implies that there could be an answer that is close to the truth or close to correct, but isn't the most correct. And that often happens when there's a process that needs to take place. And the question might say, what is the most appropriate next action to take? And so the next action is the first action that must be taken. But your 4 answers might be 4 other actions, or might be the correct action plus 3 other actions that aren't incorrect, but they're not the next action. So read your questions very carefully, and importantly, if you see most or best highlighted or in bold or in capital letters, to double check what you are what you should be answering. Then we've got managing your time. So you have 168 minutes to answer your 84 MCQs. As I said, there are 4 options per MCQ. 1 is correct. They say single best answer. So which answer is the single best answer out of these 4 options? And that means that you've got approximately 2 minutes per question. We've already said there's no negative marking, so don't leave anything blank. Okay, and so that brings us to the general question examples. The QR code is on the screen, and we will also paste the link in the chat for you, in the Q&A for you. Please, you've got 10 minutes, and that means that I will see you back here at 10 to 12. Off you go. Okay, hopefully you have, we've got 128 responses. I think that's a good option for us to start going through the questions. Those of you that are still busy, please continue. So let's start with the first question. The first question said, what is the most correct term to use for stock that is at the end of its product life cycle and has not seen any sales or usage for a set period of time? This question is very typical of a knowledge question. It is a straightforward definition. We do get damaged stock in a pharmacy, we get expired stock, and we get obsolete stock. Unusable stock would be more of an umbrella term, but the term that fits this definition best is obsolete stock, and it looks like the majority of you did get that question correct. Right, so let's move on to the next question, question 2. Question 2 says, which of the following sectors is the first point of entry for patients seeking healthcare services in the public sector? Again, another example of a straightforward knowledge question. The correct answer is a primary healthcare facility. Thank you. We can move on to question 3. Now, the next question is very typical of a basic pharmaceutics question regarding dosage forms or routes of administration. The question says, which of the following medicines can a pharmacist assistant basic assist in the manufacturing of? Now, what's interesting about this question, it's a little bit more applied. You've got to, number one, know what your scope of practice is. And in terms of a basic assistant being involved in manufacturing, they can only manufacture non-sterile medicines. And if you look at the different dosage forms, you need to know that the only non-sterile dosage form listed here is a suppository. TPN, subcutaneous injections, and eye drops are all sterile preparations which are not within the scope of practice of a basic assistant. So we're testing two things here. We're testing dosage forms and we're testing scope of practice. This becomes a problem-solving question because there are two different topics that you've got to have foundation knowledge of to be able to apply correctly, evaluate the information, and then apply it correctly in this particular question. Right, so let's then move on to question number 4. Which of the following tasks can a pharmacist's assistant basic do in a community pharmacy? So this, again, is very much a scope of practice question. You've got to know what your scope of practice is and the application of your scope of practice in a pharmacy. This particular question does specify in a community pharmacy. So if you look at the incorrect options, I'm going to start with the incorrect options. Update a Schedule 6 register. Okay, a basic assistant may not handle Schedule 6 medicines, so that one is incorrect. Counsel a patient on how to take their medicine. If you go and look at the scope of practice, if you know your scope of practice, you should not be coming into contact with a patient as a basic assistant. And then perform a blood glucose screening test. Again, that requires you to be in contact with the patient, so therefore that is not within your scope of practice. The only one that can be correct is to capture stock onto the inventory system. And so many of you got that one correct. This is a dosage form question. What is a tablet that must first be dissolved in water before swallowing, known as? Again, a straightforward knowledge question. It's linked to a definition. And the question here is, the answer here is an effervescent. So a buckle goes on the inside of the cheek. Modified release is a tablet that is usually coated, not one that is dissolved in water. A sublingual goes under the tongue, and your effervescent tablets are like your Corenza C's or your Barocca that gets dissolved in water before swallowing. Right, the next one. Where is the site of administration for a dosage form that uses transdermal delivery? Another knowledge question. Transdermal speaks of the skin, and therefore the only correct answer is the skin. And 129 of you got that correct. Question 7. If stock is received on the 3rd of July 2025 with an expiration date of the 30th of December 2025, and there is already stock on the shelf with an expiration date of the 30th of January 2026, using FEFO, how should the stock be packed on the shelf? So you need to know what the definition is. What is FEFO? First expiry, first out. And then you need to apply FEFO to this scenario. So we've got stock that was received on the 3rd of July, and the expiry date of that stock that you've just received is the 30th of December 2025. But there is stock on the shelf that only expires 30th of Jan 2026, known as your current stock. And so how must you pack the stock on the shelf? If it's first expiry, first out, that means that the 30th of December stock, which is the new stock, must be packed in front of the stock that is dated later, where the expiration date is later. And therefore, your current stock must be packed behind your new stock. Okay, which is unusual because often the stock that you're just receiving is usually got the later expiry date, and so you pack that at the back. But in this particular case, that is switched around, and so your current stock, the stock that is on the shelf, must be packed behind the stock that you've just received. Number 8, which of the following statements would apply to a tablet that is packed in an amber bottle? This again is a little bit applied, but also requires you to have basic knowledge. If a bottle is amber, it's those brown color bottles. Why would we pack a medication into a brown bottle? That's usually because the medication is sensitive to light. And so the tablet is light sensitive is the correct answer. Again, most of you got that correct. Number 9, here is a question around the use of computers. Which computer program is most suitable for report writing? So you could possibly use a PowerPoint to present a report, and you could use an Excel to capture some data, which you might use in your report. And Teams is like what we're doing today, you would use for online presentation. But the most suitable, most is highlighted there. The most suitable for writing a full report would be a Word document, which you may then later use to present in PowerPoint, but the most correct answer here is a Word document. Again, most of you got that correct. And then the final question, what reference source can be consulted if a pharmacist assistant basic is unsure of what the specified cleaning product is to use when cleaning equipment in a community pharmacy? Now this question, yes, most of you got correct. It's a standard operating procedure. A good pharmacy practice will tell us that we have to keep our equipment clean, but it doesn't specify the exact cleaning product that we must use. So the most correct answer here is your standard operating procedure, which in your pharmacy will specify the exact cleaning product that must be used for a specific type of equipment. Right, so that brings us to the end of this particular session, and we're going to have a question and answer session now before the office takes over and takes you through the online system. Puseletso, will you be moderating the Q&A?
Yes, I'll do so. I'm just checking if there are any questions posted at this point. Okay, I see most questions were related to the QR code. I can't hear or see the presentation. Okay, so this person was struggling to hear, but we can hear from our side. I can't see or hear anything. Seems like the same person. I would assume they had a technical issue. I'm trying to just get to the questions. Okay, so there are no questions on the chat. So people that want to ask question can raise their hand and we can take it from there. If you can, Mr. Glenn, if you can assist with unmuting those that will be asking questions.
Somebody asked
Yeah, I don't see any
questions
hands.
on the chat to make it easy for us to go through
Okay,
them.
to use the chat. Okay.
Yes. So if they can please use the chat functionality or Q&A, and also the attendees on YouTube, if you can post your questions on YouTube via the chat function, that would be great.
Okay, please take this opportunity to ask questions because we have our facilitators that will be able to assist with the questions.
I see that there is a question about, I didn't hear clearly about the references. I can just say that maybe the user can access the recording, or the guidance document will also tell you which references or the guide to references to be able to prepare. I'm not quite sure what the question is. It just says I didn't hear clearly about references.
Okay, and maybe just to add, Dr. Fogati, the reference, it's page 10 of the manual. So there is a list of suggested references, as well as the websites that you can access during the exam. So we have the SAPC, SAPRA, the EM guidance, as well as MAC manual. So, but the suggested list of references can be accessed from the manual, which is accessible on the website. Okay, and then there's a question which is not related to calculations or general questions. How long after do we have to wait for results? This will be covered on the remote online examination. So I think we can just keep to the questions related to calculations and the general section of the exam. Glenn, do you see anything else? I'm not seeing anything on my side.
Not at the moment, and also on YouTube, we don't have questions at the moment. I think the most questions that you have will be dealt with during your sessions regarding the results. So you'll be covering that.
Okay, thank you. Thank you, Mrs. Berry. Thank you, Dr. Fogati. I will take over if everything is well on your side.
Thank you so much.
Thank you very much. Bye-bye.
Colleagues, please confirm if you can see the screen.
Yes, we
Yep.
can.
Okay, thank you. I hope everyone that joined the workshop still has energy to go through the remote online examination. And I must say, even if you studied very well, if your equipment is not ready for the exam, you might not be able to write the exam. So let's just go through the remote online examination, what you need to prepare on your side to make sure that you are able to complete the examination. So in terms of the examination eligibility criteria, we have 3 categories. So we have pharmacy assistant learner basic, those that are registered under the new occupational certificate. We have qualified pharmacy assistant intending to enroll as pharmacy assistant learner post basic on the new occupational certificate qualification. And we also have pharmacy student who has successfully completed their first year of study and they are intending to register as Pharmacist Assistant Basic. So to qualify for the exam as a learner basic under the new occupational certificate qualification, the learner must have completed at least 6 months of training with an accredited provider and must have successfully completed the knowledge, practical, and work experience modules, received a statement of results from the provider, completed the practice Eisa, and booked for the online exam. And just to focus on the results. So if the provider hasn't uploaded your result on your profile under the SAPC website, you won't be able to book. So you can't send the results to us, but the provider should have uploaded that information on the website for you to access the booking. And for those that have qualified under the Pharmacist Assistant Basic qualification, you should have registered as a qualified Pharmacist Assistant Basic, completed the practice Eisa, and then booked online for the Eisa. For pharmacy students who have completed their first year, they should have registered as a learner basic former BPharm student, completed 400 hours in an approved pharmacy and under the direct supervision of a pharmacist, submitted at least one progress report, completed the practice Eisa, and booked online. So in terms of the booking itself, information will be shared once bookings have opened. So once we as the office have shared information that the bookings have opened, you can now log in on the SAPC website, and then under dashboard, you will go to the Eisa examination, and then under the Eisa examination, then you go to the examination booking. So the minimum criteria that I had mentioned before, if you do not meet any of the criteria, the system will not allow you to book. So we have to make sure that you have met all the requirements for you to be able to book. So if you have met the minimum criteria, you will be able to see the Eisa that has been scheduled. But if you do not meet any of the criteria mentioned, if you get to this page, then you will see no examination listed because you either do not meet the criteria or there is something wrong, which you can always refer to us. So, but if you do qualify, you will see as depicted on the screen, there's an examination fee. So there is 711 payable for you to write the exam, and you will be able to see the dates where the dates for the scheduled exam. Then you can select based on the venue you prefer. So I will cover the venue in the next coming slides on the different venues available for you. And once you've chosen the venue, you are able to book the examination. There is 3 options for payment. So if you have credit on the SAPC account, you will see it will reflect as a negative. So it means you do have money in your account, which you can use to pay for the booking, or you can use your card, Visa or MasterCard, or you can use the SID, which will take you to your banking platform. So it's more like an EFT. So in terms of the examination booking, if the payment is successful, the record will appear as pending as depicted below. Once payment has been verified, then a case will be created and the candidate will be added to the exam. If payment is declined, you will receive an SMS saying that the payment was declined, therefore booking not made, then you'll have to make another booking. So in terms of preparing for the examination, what we have here is the upcoming dates for the Eisa. So we have one for the practice Eisa scheduled for the 14th of October 2025. And for the actual Eisa, it's the 2nd of December 2025. There's no payment required for the practice Eisa, but the 711 will apply for the 2nd of December Eisa. So the bookings will open on the 20th of October. We will send communication once the booking. So you don't book or you don't attempt to book unless you have received communication from Pharmacy Council informing you that the bookings have opened. So if we haven't sent communication, do not attempt or send us emails to ask if it's open. You wait for the communication. So the communication will go out by the 20th of October. So that's when we have the initial booking and will close on the 6th of November. So if you have missed this time frame, you will then you can still book, but that will be considered a late booking, and that will open on the 7th of November and close on the 20th of November. But the late booking fee there is 1,066.50 cents. So where do you find the Eisa manual and practice papers? So if you log in onto the SAPC website, it's sapc.za.org, and you go to registered persons, and under registered persons, you go to, it is learner, student, and I think technician. Then you can access all this information. So under the assessment tab, you will see there is a practice papers. You can click there to access practice papers that are loaded on the website. And for the manual and blueprint, you can also just click there to download. That's where you'll get all the information related to the Eisa basic. In terms of the remote examination, so we have 4 categories of venues. So we have remote home, that's if you're writing at the place of residence. We have remote work, if you're writing at your workplace. We have others, so it could be a library. And then we also have the SAPC offices. In terms of where you're going to write, if you have equipment, reliable connection, you can write residence, home, or other. But if you either don't have an equipment needed for the examination, or you don't have reliable connection, or you might be experiencing load shedding, we always advise that you select SAPC as your venue of choice. In terms of the remote examination, it's important to note that even though it is a remote examination, rules will always apply. So if you are sitting in an examination center, you have to picture this exam as the same. You have to find a quiet, suitable place where you're going to write with enough space for your devices as well as your references. Where you're writing, obviously the noise levels also you have to make sure that it's a quiet place. You have to keep calm, communicate with your remote invigilator if you're experiencing any difficulties. So I'll explain as we go along, but while you're writing, this, as I said, is a examination. You will have invigilator, and you are able to communicate with your invigilator remotely as well. You have to make sure that you download all the electronic references before the examination. I think we did cover this with Dr. Fogati. Page 10 of the manual lists the suggested list of references that you can use, as well as websites. So if you plan to use references from the Pharmacy Council, you can download beforehand. That is the Act and supporting regulations. You can also do the same with SAPRA, manual, and the guidance document. Ensure that you have equipment that you need. That is your calculator, paper for practice to work out your calculations and so on. In terms of the device and connectivity for candidates, and this is what we experience most with candidates on the day of the exam, where they struggle to write because one of the equipment is not working. So what we suggest as a device, you can use your computer, or you can use your laptop. You need a phone with a QR code scanner facility. So the device must have a camera linked with video capabilities. You must have connectivity with a minimum of 3G, and the browsers, you have to make sure that you have Google Chrome, Firefox, and Microsoft Edge. And if you are using your MacBook, which obviously has Safari, make sure you beforehand you download Chrome, Firefox, or Microsoft Edge, because you will not be able to use the Safari. In preparation for the exam, you have to make sure that you have uploaded your most recent picture onto the SAPC website. So it must be a color image and it must have been taken in the last 6 months. And it must cover head and shoulders. So this is very important because as you're writing, you will see that the picture that you have on the website must be aligned to yourself during the exam. And this will be used then by the invigilator to verify that you are the right candidate writing the exam. Okay, this is just an example to show the picture. So you can log in onto the website, go under your personal profile, and then if your profile picture is too old, then you can go and choose another picture that you can upload. So where do you find the examination? So under registered persons, learner, student, or trainee, this is where you can access the examination. But we do share information the day before the Eisa, also directing you or giving you guidance on where to go or the link. So under the registered person, you will see on the day of the exam. So if you go to the website today, you will see under external integration summative assessment, the date that you see is the 14th of October because we do have a practice exam scheduled for the 14th of October. So if you're writing on the 14th, this is the date you're supposed to see, and then you click there then to access the exam. If you're writing on the 2nd of December, the date then would say 2nd of December. So the date is aligned to the day of the exam. So on the day of examination, even though the exam officially starts at 9, we urge candidates to log in at 8 o'clock. So you log in onto the SAPC website, enter your one-time PIN that would be sent to your cell phone to enter the examination. And you will complete the declaration and read the examination rule. The reason why we urge candidates to log in at 8 is to make sure, should you experience any challenges, you are able to contact the office and then we can assist before the commencement of the examination. So the exam will start at 9 o'clock and there is live invigilation through video streaming. Images are taken to verify that the candidate is who he or she supposed to be. And then the examination then will end at 12:30. Once you log in, you'll be taken to the examination platform. So you'll enter your PIN number, ID number, and password. If for any reason the current password is too difficult for you to remember, or please change it beforehand. Don't change it on the day of the exam because then you might struggle then to log into the exam. So you'll enter your PIN number, ID number, and password. And once you've entered that, you will receive an OTP onto your registered cell phone number. So again, if any of your information has changed, whether it's the email address or it's the cell phone number, please update now because that's where you will receive your OTP, which is only valid for 10 minutes. So if you don't have that number, you might struggle then to access the exam. So the system will take you through the proctoring system, which I will show you, and then you will go to declaration. And once you have accepted, you will be able to start the exam at the time when the exam starts. That's 9 o'clock. And as you're writing the exam, you will see the time will be shown at the top of your screen. So the exam starts at 9 and at 12:30, so 3.5 hours. It's countdown. Then from there, you'll see how much time you spent on the exam and how much you still have left. And at the end of the exam, when you submit your examination, you will then automatically be taken to the post-examination survey. So steps to log in and access the examination platform on the SAPC website. So as I said, this link, which is depicted here, you can either use the link or you can go to assessment under registered person and go to learner or trainee and then you can then access the exam. As I've said, your login credential is almost the same. And don't forget, when you capture your P number, there's always that P before the 5-digit number. So if you just capture the number, then you will not be able to be verified. So it's P number, your ID, as well as the password. You then receive the OTP on the registered cell phone number. And then this is where you go through the equipment check. Most people struggle at this stage because they will either have a browser webcam check and then it fails because they didn't enable the webcam before the exam, or the microphone check fails. So you have to make sure you do your equipment check before the day of the exam, and make sure that you do allow access to your webcam, you do allow access to your microphone as well, your browser, those 3 that I have mentioned, you use those ones. But if you use any other, you might have a browser check failing, and that your network is stable and accessible on the day. So these slides will be saved on the SAPC website under assessment. You can then access this presentation and use this link, the proctoredu.com, to make sure that you check for these before the day of the exam. And should you have any other challenge, then you can sort it out before the day of the exam. And also what's important is to make sure that you make sure all the updates are done before the exam, because sometimes those updates could be the reason why your equipment check fails. So if all these checks are green, so it means you are able to move to the next step of the exam. But if any of these appear red, then you will not be able to move on until it has been sorted out. So filling in, here you just click next, you don't have to do anything. And then on the verification, so that picture that you have on your profile is where now it becomes important, because you need to take a photo of yourself before you're able to move on. So this photo that you're taking then will be compared to the picture that you have on your profile for verification. Okay, scanning of the QR code. So the scanning of your QR code, you will use your mobile or smartphone, mobile device or smartphone to scan the QR code. That's why you have to make sure that the phone that you're using has the QR code scanning capabilities. So you use the phone to scan the QR code to connect your phone to the examination platform for a better view of your workspace and examination room. So because the computer you're using has camera capability, we're able to see your face. But then in terms of us seeing the examination room or the workspace where you're writing, you need to connect your phone. So you click on play button 2 and record a short video of your room surrounding. And then once that has checked out, you then complete the examination declaration. The declaration is just to commit to that you're writing the examination in a place that is stipulated in your booking confirmation, that you're not sitting next to or in close proximity to other candidates writing the examination, and that you will not receive any form of assistance from any person while you're writing the examination, and that you'll not communicate with people during the examination. You will not use reference material that's not, you'll only use the reference material that's permitted for the examination. You will not give any assistance to any other person writing this examination. You will not share, copy, or discuss the examination with other people during or after the examination, and you will inform the Pharmacy Council if you are aware of any candidate that is contravening any of the code of conduct. So once you've gone through the declaration, then you are able to now move to the next step, and you will read the examination instruction, and at 9 o'clock then be able to start the examination. So if there are any delays on our side, we'll communicate with everyone that is writing on the day. Okay, so once complete the end of examination declaration. So once the examination has been completed, you can now submit and then move to the survey. So at the end of the examination, what you will now submit is that you confirm that you have completed the examination without assistance from anyone, and you will not or did not share any of the examination content. So important message to take note of. So if at any time or you're trying to log in and it says your time is incorrect or you are at a different time zone, you have to make sure that you adjust your time, because your time zone should be aligned to the time zone of the SAPC. So if you're writing in another country, you have to adjust your time zone then to be South African one, so that you can be on the same time zone. It can also, this is one of the messages you can get, or an error message that the live proctoring is not connected. So you're not connected to the live proctoring system and the session will be terminated. Other messages that you may get is that you trying to start the examination before, so you have to wait for your invigilator to start the examination before you start writing. And then if you see the green tick, then it means the examiner has started the examination, then you can proceed and write. So the format of the examination, I think this was covered before by the other facilitators, that there's no negative marking. There's one question per page, and cannot select which question to start with because all questions are randomized. So if, let's say, 10 people are writing the examination, one person's number one will not be the second person's number one, because all these questions are randomized. So it's a timed examination starting at 9 until 12:30, and you are not allowed to, or you cannot revisit any question that has been answered. So once you've submitted the question, it's already submitted and saved, so you can't go and revisit that question. An answered question may be revisited. So if you pass the question because you're still thinking, or you still you want to pay more attention to the ones that you know you can, and then at a later stage, then you will be able to go back to those unanswered questions. So there's only a single best answer for every question. It's a multiple choice question, so you will have 4 possible answers. Then you have to select, obviously, the best answer for that question. Violations during the exam. What is important is that you do have access to websites, and these are covered under page 1011 of the manual. So you can access the Pharmacy Council website, you can access SAPRA website, but you cannot use Google to access this material. So if you're accessing SAPC, you go directly SAPC, because Google is not allowed to be used during the exam. Any action undertaken by the candidate to gain unfair academic advantage, let's say using Google, is not allowed. This may include, but not limited to, cheating or copying, as well as possession of unauthorized material. So should you maybe attempt to go to Google, your invigilator will communicate with you to tell you to stop. But if you do not stop, then you can be removed from the examination. So other things you will see, if there's any conversation from your invigilator, you will see it. Let's say you're no longer connected to your phone, the invigilator will communicate that with you. Or if there's any other issue, or your other camera is not, your computer is not sharing the second screen, that will be communicated to you to resolve on your side. So these are the frequently asked questions, and this is based on the questions that have been asked before by other candidates, or yes. So we have developed a frequently asked question to assist any other candidate writing the exam. So the chat function, you are able to type your question in the chat function, and your invigilator then will respond via the chat. There's also WhatsApp. You can send a message to the invigilator on WhatsApp, and the invigilator will respond. You need to keep calm, because when you're asking questions, you're not necessarily the only person asking questions. So it might take maybe some time to get the response, but you will get the response once the invigilator has looked at your message. You always have to keep your cell phone next to you. And when I say cell phone, is the one, the number that is registered with Pharmacy Council, because we can use that then to communicate with you. So ensure that it's fully charged and you do have data on the phone. The invigilator may call or send you a message on the cell phone number you have provided to SAPC. So it's important to always update your contact details on the website. So what happens if you experience load shedding or loss in electricity while you're writing? Important is to always keep calm, check your load shedding schedule and make alternate plan. Ensure the laptop is fully charged before the examination. Ensure that there's alternative Wi-Fi connection if you're not using a fiber connection. If you are unable to find an alternative Wi-Fi connection or need to be connected to a power supply, please find an alternative location. But what's important is that you should always notify us via WhatsApp number should there be any changes during the exam. And if load shedding occurs during the exam, your work will still be saved while you're trying to make an alternative plan. So what happens to the questions you have answered if you lose connection? Again, you have to keep calm. All questions that have been submitted are saved. So you will not lose any work that you've already submitted. When you log on again, you will only have access to the questions that you have not answered as yet. The questions will be randomized, as I said, and they may be renumbered when you regain your connection. Continue to ask the questions as they appear. What should you do if the invigilator notifies you that they cannot see the cell phone view during the examination? You have access as highlighted here. You click there, scan the QR code again to ensure that your cell phone or smartphone is connected to the exam platform. So this highlighted area, normally you will see your picture there. So that's where you will click to regain connection. And what should you do if you need to change exam venues? All changes to the bookings must be communicated via email to SAPC. So if you have booked to write at your workplace, but now realize that you might not have equipment sufficient for the exam, you can send an email and let us know that now you're moving from remote work to SAPC offices, then we can make those changes. And what should you do if you're disconnected and on logging back, there's this pop-up, this page was opened elsewhere. So you have to close all the browsers that are currently open on your computer. You must refresh and delete any data or browsing data for the last 24 hours and then try and log back in again. Where you sit it is very important. So images are taken of candidates throughout the exam. So what's important is that your the room you're writing in or the workspace should have sufficient light. You have to make sure that you test this lighting beforehand and take a selfie of yourself. Ensure that the camera is on. And very important, test appropriately. You might decide to write the exam from home, but you should still treat this as an exam. So you will shower and dress appropriately, not in your PJ. So yes, so that because as I said, the images are taken from time to time. So you have to be presentable. If the invigilator cannot see the images taken, they will phone you on your cell phone. That's why you have to make sure that your cell phone is on and fully charged. When will you receive the results? I think there was a question on the chat as well. Can you view your exam paper? Can your examination be remarked? So the exam results will be released once the results have been analyzed and verified. This may take some time, and that's a minimum of 6 weeks. So for those that will be writing on the 2nd of December, you won't get your results within 3 days. So there are people that wrote on the 23rd of September, and they're emailing us every day. And like I said, for the results to be analyzed and verified, it will take a minimum of 6 weeks. So it can be more. Minimum is the 6 weeks. You may apply for review of your examination if you feel that maybe the examination, you think you performed well, but when the results come out, you didn't get the mark that you thought. So you may apply for review of examination. You will have to complete an application form and pay for the applicable fee. You will be allowed to view the exam questions and the answers that you provided. The correct answer will be indicated. You may ask the facilitator for the reference that was used or the steps to the calculation, and you are permitted to make notes. However, you may not take copies or photos of the examination. You may not apply for a remark. So it's answering the question of whether you can ask for your examination to be remarked because the results have been checked and verified beforehand. So if we have any questions, the communications team, you can assist on your site before we move to the post-workshop survey.
Hi, Priscilla. There's a question here. What do we need to bring when we are writing at the SAPC venue?
Okay, when you're writing at the SAPC venue, you have to bring your mobile phone, your smartphone with a QR code scanner, and that's about it. But if you prefer to use your own device, you can bring your computer, but the SAPC exam venue provides everything that you will need for the day except for a phone.
Where can we find past question papers if there are any available?
Okay, I think I did cover that, but if you go to the SAPC website, I will show you now. You can, you go to the SAPC website, you click on the website, under registered person, you'll go to this tab on the left-hand corner that has learner, student, or trainee, and then under assessment tab, that's where you can get access to the past paper. So you see here it says practice paper. You may download practice Pharmacist'S and basic Eisa paper by clicking here. So this is where you can access the past papers.
I just wanted to confirm, if we fail the practice exam next week, does that mean we can't write the test in December?
No, so the requirement is that you have written a practice exam. So the results of the exam are not important. As long as you have booked and written the practice paper, you can still write the exam on the 2nd of December.
Does one have to write the ASA exam first to continue and register for the post-basic?
Yes. So if you are currently registered in those 3 categories, I'm just going to go back. So if you are currently registered as a learner basic registered under the occupational certificate, you write the exam. So it's a part qualification. So if you don't want to continue, you still have to write the Eisa and pass. Then you'll be registered as a pharmacy assistant. But if you're currently registered as a qualified pharmacy assistant, but you want to continue and register as a learner post basic, whether under whether you're occupational certificate or you're pharmacy assistant, you will have to write the Eisa. So you can continue to the next level if you haven't written the Eisa.
How do we access reference books?
So the list, so we do have we can use physical books. The list is in the manual, but if you want to access the online, you can download beforehand, or you can also the physical books you can use, but you can also then access those that are on the website, download beforehand. But the list is available in the manual.
Can I change my place of writing the practice Eisa now, the one on the 14th of October?
Yes, you can still change. You will send the email to PSP Eisa, and then we will respond to it once we have made the change on our side.
Will the practice exam be held under the same conditions and processes as the actual exam, i.e. login processes and invigilation and 2 devices?
Yes, I think maybe we just need to understand what is the purpose of having a practice exam. So the practice exam is to assist you in preparation for the main exam. So the same conditions apply, the logging in, making sure that you're logged in, your cell phone is logged in, there's checks. So whatever applies for the examination, the practice paper, just to get you ready and see what you might need to fix before the main exam.
Will my answers be captured and submitted if the time elapses before I click on submit or finish my exam?
Yes, all the questions submitted are saved automatically. So let's say the exam ends and you're still on question 98. So all those 97 captured or submitted will be saved automatically. So you'll be marked based on those that have been submitted.
Why does this appear on my pre-registration examination? No pre-registration examination booking listed for the 6th of the 10th, 2025.
Sorry, Natalie, I didn't get that.
Why does this appear on my pre-registration examination? No pre-registration examination booking listed for the 6th of the 10th, 2025.
Okay, so I think the person can share their PIN number and we'll check it. But most of the time, if it doesn't appear, it's because the examination eligibility criteria is not met. But they can share their PIN number, then we can assist.
What time are we writing on the 14th at the SAPC?
Everyone that's booked for the exam will start the exam at 9 o'clock, but should log in at 8.
Where can we get the WhatsApp number, or do we get it the day of the exam?
So it's here. So you can use this QR code or the link to access the WhatsApp.
For the practice exam, one has to book, and what to do if it says no exam listed?
I think it's the repetition. So if it doesn't appear, it means you do not meet the examination eligibility criteria, but you can send your PIN number and then we will check what is the issue is.
So Leto, just to make a correction here, the code that is showing at the moment is for our WhatsApp channel where we make announcements. Basics will receive the contact number for the WhatsApp line the day before the exam.
Sorry about that, yes.
Who can we contact if we have connection issues on the exam dates?
Connection that is on the WhatsApp. If the person has already been logged on, so they do have access to the chat, then they can chat directly with the invigilator. But if you are unable to log in from the start, you can then use our WhatsApp number to communicate that.
So if I don't scan the QR code, what happens?
You will not be able to move to the next step. So you won't be able to write the exam.
If one doesn't make it, when will be the other Eisa exams?
Okay, for 2025, the last one is on the 2nd of December. So the dates for 2026 then will be published in 2026.
What will happen if I receive a call during the exam process?
A call normally disconnects if you answer the call and it's not from Pharmacy Council, it might disconnect you from the examination. And as I said, the Eisa should be treated like any other exam. You cannot answer the phone while you're writing the exam, except if we as the office are trying to get hold of you.
Where do we send the proof of payment?
Proof of payment you can send to PSP Eisa, but you can also send to okay, if you can help me, Lisbeth, and just paste the email address for the finance PSP. That will be shared on the chat just now.
A question from YouTube. Do we also wait from you to write the practice, or are we allowed to book through those dates discussed?
For the practice, the bookings are currently open. So if candidates wants to book, they can just log into the SAPC website and book. I think the bookings close on the 9th, which is Thursday, if I'm not mistaken.
For those who chose work for the writing sites and there aren't many rooms to accommodate all of us, how will this affect us?
You will have to change the venue. So if the conditions do not support the examination, the writing of the examination, so you can then choose another venue. And if you do not have any other venue, then you can opt for the SAPC offices.
Are we allowed to use other reference materials, for example, notes provided by our institutions or our own notes?
Yes, you can use your notes. What you can use is you cannot use past papers during the examination. So any other notes prepared, you can use.
Where can I book for the practice exam?
You go to SAPC website and you log in, and under logging in on the dashboard, let me just correct, sorry. So you log in, and under the dashboard, you go to Eisa examination. Then after that, you go to examination. Okay.
How do I know if I've successfully registered to write the ASA exam? I received an SMS, but not sure if I did it correct.
Okay, so once you have booked for the examination, you will have access to the Eisa booking confirmation. So if you go to the dashboard, you will see the tab just before the Eisa examination. It says letters and certificate. That's where you can access the booking letter.
We're getting a lot of requests for a recording of this workshop. Just to confirm that this will be available on the SAPC official YouTube channel immediately after the workshop. Which email do I use to send the P number to check regarding it saying no examinations listed?
It's the PSP Eisa email address. This one, psp.eisa@sapc.za.org.
Do we pay for both the practice and the official exam on the 2nd of December?
No, there's no fee applicable to the practice exam. You only pay for the actual Eisa scheduled for the 2nd of December.
After writing my ASA, are we allowed to take a gap year and register again?
Yes, so if you have written your ASA and you decide that you don't want to continue, you can go ahead and do that. Though, but if you're still practicing, then it means you still have to pay the applicable fee, unless if you're leaving the profession as a whole.
Where are the SAPC offices?
We will paste on the chat, but it is 591 Belvedere Street in Arcadia, Pretoria.
Can I use my institution textbooks as reference?
Yes, yes, you can.
So both exams, practice and the actual exam, are open book exams.
Yes, both are. But I think what's important, Dr. Fogati did touch on this. Don't overload yourself with or just don't have too many references, because as much as it's an open book, you should have an idea before you start the exam. But yes.
Since we finished work practicals in November, does that mean we won't be able to write in December?
So if you're 6 months, it's before the actual exam, you can still write. But if you only you should have met the minimum of 6 months before the exam. So
how do we make sure our gadgets are ready for the test?
So you can do the test. This will be available on the website. The presentation will be available on the website, but you can use this link to do the test for compatibility.
I did the booking for the practice and received a confirmation text, but the booking is not listed on my dashboard. Should I be worried?
Please check the letter and the letters and certificate. If you are booked, then it means you are booked for the exam. You don't even need to confirm with us. If you have received the confirmation letter, it means you are booked for the exam.
Am I allowed to rewrite if I fail the Eisa? When is the date of the practice exam?
If you choose to write, this is the only date for the practice for 2025 that's left. That's the 14th of October. And the dates for 2026 then will be published in 2026.
If we fail the practice test, will we be able to write the final exam on 2 December?
Yes. The requirement is that you should have written the practice exam.
What if the practice exam dates are not displaying under my dashboard?
So possibility is that you do not meet the examination eligibility criteria, but you can send your P number and then we can have a look.
Okay, we have 5 minutes left in the session. If anyone wants to ask any questions, please type them in the comments on YouTube or in the Q&A section on Teams. Do we need our statement of results to write the practice Eisa exam?
Is that the statement of results should be uploaded by the provider on our website. So you don't email us your statement of result. The provider, they are aware what they need to do. So if at the time that you're trying to book, it still has your statement as outstanding, then you need to follow up with your provider.
Just to make sure, when we write the exam, our other device is facing directly to you when you write on your laptop. Is that correct for the invigilator?
The other device is the phone, and if it is not placed properly, your invigilator will communicate and guide on how you can place your device.
You said we cannot book for the actual exam till we receive the communication from you after progress results posted by the provider academy. You can't book before that.
Okay, we have as depicted now the important dates. So we will open the bookings on the 20th of October after we have shared the communication. So before then you can't book.
How do you check your profile picture?
Sorry, I'm just going to. So if you log in onto the Pharmacy Council website and you go under your profile, that's where you'll see your profile picture. If you choose to change it, then there's the option to choose another file.
Is the new qualification related to pharmacy technician, or we have to study further to become that?
Yes, so I assume everyone that's on the call is either learner basic or qualified basic. So the current qualification is you have occupational certificate basic, then you move to post basic, then technician.
Yeah, that's it. Doesn't look like there are any more questions.
Okay, you can guide us then, the communications department. Should we wait for the 3 minutes, or we can officially close the session? I'm just going to display the QR code then for the survey.
Great. I'm also posting that any further questions can be emailed to psp.eisa@sapc.za.org. And I will also share that link in the comments now.
Yes, and I just forgot this one, Natalie, just to address, because I've received a number of emails where people are saying, I cannot book, no screenshot shared or P number. Please, every time you're experiencing challenges with the booking or anything else, please take a screenshot and also share your P number. It's easier for us then to navigate and resolve your issue. Okay, have you posted the link in the chat?
Yes, and there is one last question. Just to confirm, must all the modules be completed prior to registering for the practice test?
Yes, I think we just go back to, because it's not just the modules, so you have to meet all the criteria. So I'm just going back, sorry, Natalie. So if you're currently registered under the occupational certificate, you should have a minimum of 6 months of training with the provider, successfully completed the knowledge, practical and work experience, received your statement of results from the provider, and completed Eisa, then booked for the online exam. So you must meet all these requirements. It's not just one.
Final question before we close. Can I apply for B Farm after studying post-basic?
Okay, yes, if that is but this is not the line. So in terms of the PSP, which is the pharmacy support personnel, it's basic, post-basic, then technician. But if you want to leave the PSP line and start your B Farm, then yes, you may.
I think this very last question is an important one. I don't have a laptop. Can I use my phone to write the exam?
But you need to either use a computer or a laptop. If you do not have, or your workplace or any other place that you can think of does not have a computer, the Pharmacy Council offices become your option. And even if you do, let's say, borrow a computer from a friend or family, just make sure that you test that it is suitable for the exam using that link that I shared earlier.
That's it, Pusiletso. We can wrap up.
Okay, thank you everyone for making time to attend the session. Should you still have questions after the session, you're more than welcome then to send an email to the PSP Eisa mailbox. Please don't send a WhatsApp, just send emails, please. Thank you. And we can adjourn the session. Thank you, communications team. Natalie, is all in order?
Sorry, Pusiletso, we're just going to quickly share the attendance register as well. We did share the survey. for the workshop. We're just going to share the attendance register now.
Thank you. Bye, everyone. Have yourself a wonderful day.
I did share it.